everybody. Brianna here with Nurse Deck for another installment of our Insider Perspective interview series. We here at Nurse Deck are a site built by nurses for nurses. We aim to provide collaborative social space for nurses across all levels to share their resources, guides, camaraderie, humor, stories, work-life sanity savers. And we are proud to join many of the voices in the nursing workforce together for you guys. Today, we are joined by Marcia Proto. Marcia has led the nursing workforce efforts in Connecticut for over 10 years and currently works for two nursing associations in Connecticut, the Connecticut Center for Nursing Workforce and the Connecticut League for Nursing. While she is not a nurse herself, she has dedicated her time and career to addressing Connecticut's nursing shortages, nursing student capacity issues, online education for reentry into practice, and a whole ton of professional development avenues. She even has her own consulting firm herself. Marcia, welcome. Thank you so much for joining us this morning. Can't wait to hear your story and what you're doing for the nursing workforce in Connecticut.
Thank you, Brianna, for inviting me and Nurse Deck for really highlighting what's happening in nursing around the country. It's a wonderful format, and thank you for inviting me today.
Absolutely. So we like to start from the beginning. How did you get started in healthcare and working for nurses specifically?
Sure. Graduating with a master's in organizational development, I ended up in the nonprofit world, higher education in the nonprofit world. And then my first adventure into healthcare was actually as manager of education services at the Connecticut Hospital Association. And that was in the early 90s. Mm-hmm. And if you remember the early 90s, healthcare was booming, reimbursements were high, and in my role provided education programs to 35 different groups that met at the hospital association.
Wow.
Everything from CEOs through directors of social work, directors of emergency services, and also nurse educators and nurse execs. So that's how I got steeped in all of the issues, looking at hospitals per se as that ecosystem and environment.
Yeah, what a range of people to be servicing, though. I mean, the needs from just those various communities must have been, that's a huge umbrella to provide for.
When we had our, each of those roles had a monthly or every 2-month meeting. And so in addition to sharing and looking at solutions and best practices that could be spread throughout the state, a lot of large issues were looming, capitation and payers. Mm-hmm. Also different best practices were emerging. So if there were topics that covered many of the groups, I would bring in national speakers for full day education programs, or if it was a specific niche topic, a presenter would come into their specific meeting groups to share information. So it really was a wonderful opportunity to, that interprofessional development was starting way back in the early 90s.
Wow, very cool. Tell us about your journey into the work that you do today. I know you have a master's in education. Did you have any inspiration for going into that field when you got started?
No, actually, I worked in higher education at the University of New Haven in the area of career planning and placement, so workforce development and the whole capacity of finding the right fit for an employee going to an employer, regardless of the setting, was truly at the core of what I wanted to do. I think workplace satisfaction and aligning your skills and abilities with the role makes one fire on all cylinders. Yeah. And so transitioning into healthcare, you really saw from the clinical preparation that they have ready for the roles, but putting them in the right environment so they can fire on all cylinders. Wow. Not only provide value to the entity, but be happy in what they do was just so exciting. And so that's why I think nursing education and healthcare education really pulled me in.
Yeah, absolutely. I think a lot of nurses can relate to that if they feel stuck where they are, or they feel like they're not really living up to the potential of what they could be doing. It's a frustrating experience to be in, one that many of us do solve by pursuing higher education opportunities. So I think a lot of nurses can definitely relate to that.
Yeah.
Let's talk about current working conditions for nurses as you are experiencing through the work that you do. Can you talk a little bit about that, about what nurses are, the challenges they're going through?
Yes, I can. And we're very fortunate at the Connecticut Center for Nursing Workforce to not only work with all of our schools and programs of nursing in the state of Connecticut, who provide, doctoral education down to the LPN education, but also working with our practice partners. We have regular scheduled meetings with our nurse educators within mostly the hospital setting, and learn firsthand related to the gaps between graduation and
Yeah.
practice, not only at the pre-licensure levels, but also at the master's level and advanced practice as well. Healthcare is just moving so quickly, yet our education and our curriculum and our experiences don't move as fast.
Right.
So we're always going to have a gap between those who graduate, even though they pass the national licensing exams, with how they're jumping into practice.
Yeah.
As you know, today, even before COVID, essential for the onboarding and the nurse residencies. Yet I think when you look at our transition programs for employers, even though the residencies are robust with lots of different educational components and clinical components, I don't think we have the capacity within our healthcare organizations to actually fully onboard. And this happened even before COVID. We didn't have such robust nursing education departments as we had in the mid 90s and early 2000s. I know some facilities that used to have 17 nurse educators, now they're down to 5.
Oh, wow.
So
Yeah.
how do you fully embrace that new hire, not only to make them clinically proficient and safe providers, but give them that opportunity for professional development,
Right.
evidence-based practice and research to not only continue their professional development, but support the retention of that new nurse. So I think
Exactly.
with all things snowballing at this time, we kind of need to take a step back and not layer on, but find out what's essential for the clinical side and also the professional development side to support the retention of our new nurses.
Yeah, absolutely. I mean, I know when the whole pandemic started and everybody in nursing school, my heart went out to them because I know sim labs are part of practice now, but they're not solely what you use to develop your clinical skills. So any new nurse jumping into their preceptorships when they finally get hired, there's a certain sense of sink or swim. But these nurses were really getting that because for many of them it was the first time they'd been with patients, you know?
And Brianna, you hit the nail on the head. So, come March 2020, when all of the practice settings closed every clinical experience because they didn't know what they were dealing with.
Exactly.
So our deans and directors met twice a week with us. We were in constant conversation with our Connecticut Board of Nursing. We actually have now a regular segment on their monthly meetings to really inform what's happening. And in many states, as you know, the boards of nursing regulate how much simulation can be part of one's curricula. In the state of Connecticut, we are very fortunate. We do not have a percentage. And so the board said 50%, which national resource proves that, 50% is okay to complement the hands-on clinical experience that students would get in practice settings. So we had an all-out focus, and the Connecticut League for Nursing, we created about 6 years ago what's called the Healthcare Simulation Network of Connecticut. And these are not only from the academic side of healthcare education, not only nurses, and the practice side. So we were able to convene that group. They were pulling what are the best practices that are happening. We had document sharing of what all the schools were doing, what providers of simulation were giving away things for free to schools, because we had a huge bottleneck. If we didn't do those clinical hours, we couldn't graduate our students in May, which are so critical for the workforce, because at that time in May, our employer said, keep them coming, we need the extra. So it was really phenomenal how Connecticut was able to rally in such a short period of time. As you may know, the 7 nursing organizations on a national basis put put forth a policy briefing, and what the Connecticut Center for Nursing Workforce and the Connecticut League did, we actually sent out to all the players in Connecticut and national what we could do to stem the tide for addressing the staffing surge issue, what our educators could do to keep those students as they transition to practice through ongoing mentorship, keep them moving forward so the stress of the situation didn't overwhelm them. So it's a phenomenal all-out state effort for our nursing schools and practice settings.
Right. I think that's a good reminder for those of us as we're in the doldrums of the pandemic now. The early days were such a grassroots effort from everybody, and whatever they could do, they were trying to do. And I know, you hear the analogy all the time of we were building the plane in the air as we were flying. And I'm sure that was true for you guys on the education side as well, to get those students into practice as quickly as possible. And God love them for being willing to do that, because it's a new frontier, really.
Correct. And the biggest challenges, Brianna, were our master's prepared students. The accrediting bodies would not allow the master's students, who, as you know, are registered nurses, to use telehealth as clinical hours. So we had a bottleneck of about 600 advanced practice nurses who we couldn't graduate. So working with the state of Connecticut, also working with the state of New York to see if we could expand these clinical opportunities was just critical.
Yeah, absolutely. Absolutely. Tell us, as your role, the executive director for the Connecticut Center for the Nursing Workforce, what solutions can we work on at large to help with the growing nursing shortage that's accelerated by the pandemic? I think we have a large sector of nurses that are just going to be retiring in the next 10 years anyways. But nurses that are burnt out or looking for better opportunities that are leaving the workforce. What solutions are you all working on, and what can we as a larger body of nurses do to help out with that effort?
That's a great question. So the Connecticut Center for Nursing Workforce, we were doing business as that entity since 2013. For years and years, we did collect the education data to find out what our seat capacities were at all of our programs in Connecticut. What type of faculty needs did we have? Do we have vacancies? We really looked at attrition. So we had a really good idea of pipeline, which was very important. Prior to the pandemic, the Connecticut Center for Nursing Workforce was working with the National Forum of State Nursing Workforce Centers. And there are 38 other states besides Connecticut who are members of this national group. And so they had put together a minimum data set for supply, how we could really look at who we have working, who just holds their license, what specialties do they work in, as well as what settings they work in, and age as well. So we had been sharing that data, knowing that back in 2009, when nurses were we had more than we, actually in 2005, we had more than we needed. And then in 2009, we needed more nurses than we produced. So we had a pretty good idea of our age of nursing, our nurses, but we really did a deep dive in 2018 and realized that we had a big gap in our 35 to 45-year-old population of nurses, which was very scary because they were our emerging leaders. And we had a huge boon of over 55, and we knew they were going to retire. So we tried to share with our state what was happening, and with our educational capacity, we knew what it was, and our supply, to really inform them what pipelines we needed to expand.
Absolutely.
In 2019, we actually used a demand model by the state of Washington. All of the 5 trade associations partnered with us, the Hospital Association, our 2 long-term care trade associations, our home care trade associations, our assisted living. And we also partnered with all of our 5 workforce development boards. And we conducted a statewide demand study. And in addition to nurses being the top of the heap in all settings, as well as CNAs and home health aides, we found that master's prepared social work, surgical techs, and some other roles, we didn't have enough. And we also looked at our pipelines and we said, oh my goodness, we don't even have the capacity to
Right.
produce
Yeah.
these roles. So I think it was the first time as the state looked, we held a big summit, national speakers. It was really a wake-up call to see how misaligned we are. And so
Right.
that's the type of work that the Connecticut Center engages in. And we have regular communications now set up through our Department of Public Health, our governor's office. And we were very fortunate to now getting the ears of those decision makers.
Incredible. I mean, I'm listening to this, like in my mind, I'm picturing like a map of just like, here's where we're starting and we shoot out to here and these people help us with this. And it's just such a complicated system of taking all the data that's available and arranging it and making sense of it to a practical application that I think on the nursing side, we just experience it as we had 3 call outs and we're already down 2 people. But really there's this safety net, as it sounds like, of people working really hard like yourself to address, helping these gaps that exist right now and preventing more from it accelerating into the future. So thank you for the work that you're doing. I'm sure it's healthcare is such a complicated system anyway, and so many parts of it are failing right now or need to be updated critically.
And Brianna, I think that comes to that, in healthcare, they have to go through formal education, right?
Yeah.
It's not like if somebody graduates as a marketing major and wants to be a senior vice president of marketing. He or she does not need to jump into the educational pathway, right?
Yeah.
They can go for a certificate course at Harvard for 6 weeks and automatically assume that role. What the outside world doesn't understand is the length of time it takes to produce somebody, not just for minimum ability or entry-level performance, but when we're having our nurses leave, and we saw this well before the pandemic, especially in nursing education within healthcare facilities, they're hiring 2 people to cover that role. Then they're hiring the person who retired back a couple days a week. And it's because the nurses that we had in employment stayed for such a long period of time that they amassed so many roles underneath them that if it was a new person, you could never put all of those roles underneath one person. And so the lag time is so critical. And I don't think people outside of healthcare education, but nursing specific, understand the lag time. So if they want the spigot to produce 1,000, right? We need to start that spigot 4 years ahead of time. And in Connecticut, we only accept 24% of our qualified applicants. So we have 11,000 that want to be nurses. Our seat capacity is 2,600, and our employers need 4,000. So we were very fortunate this year to work very closely with the Governor's Workforce Council and our brand new Office of Workforce Strategy. And we've put together statewide proposals to actually address it in a systematic way. You need to flip all the levers at the same time so you don't create unintended consequences or bottlenecks further down the road.
Right.
That's very fortunate that, folks like myself, our Nurses Association, our deans and directors, and all of my board members are really putting forth a systemic approach to address our issues in Connecticut.
Yeah. I mean, it's so interesting. I know it's in the news a lot about, we've been hearing about just the supply chain issues in the country. So to hear it applied to nursing, it's really fascinating, all of the nuances that go into it. I mean, it really, it's a lot. Well, let's switch gears a little bit. Could you tell us about your consulting firm, Marcia Proto Consulting, and what its mission is, what its vision is, and the work that it does?
Yes, I would love to share, and that's a passion of mine. So after I left the Hospital Association, I worked for a full-service human resource consulting company called Flath and Associates. And so I really opened up the healthcare market, really focusing on leadership development, management supervision, and high-performing teams. And so had opportunities, whether it be at Yale, believe it or not, in the IT department, and that was the time that they were creating the electronic health record. And they pulled all these clinicians from all different areas of the system to say, okay, how are we going to make this happen? And so can you imagine getting IT people together with clinicians and having them talk the same language?
Oh my, I remember when the EMRs were rolling out, and all the doctors in I was in a private practice at that time, and just the color would drain from their faces, But.
Exactly. So can you imagine how are we going to build this and make sure all the fishbone diagrams and face pages that our clinicians and nurses see with this new animal resonate with them and actually have all the elements that they need to have related to what types of practice, elements that they need to address with their patient population. So that was a wonderful, exciting opportunity. And I think that kicked off my ability to say, I have a lot of value in the marketplace, in communications and teams. It leveraged my organizational development, formal education, and an advanced degree in human resources. And so really found out that if we created a positive culture and everyone was aligned, working with the same vision, we really would be able to achieve a lot of greatness. And so worked for a variety of healthcare organizations. And also my passion was, before I entered healthcare, I was the executive director of junior achievement for about a third of the state of Connecticut. And that was business education that National Junior Achievement had. And I had volunteers, everybody from bankers, attorneys, head of manufacturers, go into the classroom and teach children about these principles.
Oh, wow.
And I said, you know what? The whole concept of mentorship and guidance also is very important. And so how do we assess that? And I kind of engaged with an organization now called Wiley Company, and that's the largest publishing company in the world, but they also have an assessment division. And so I have assessment tools for individuals and groups on everything from teams and communications, management, leadership development, productive conflict, and the new one is Agile EQ, really how we can look at the lens in which we view the world, build our emotional intelligent competency and capacity to really create positive workplace cultures. And so in addition to my two jobs, I still am working with some wonderful healthcare clients in their leadership programs, both in the healthcare world and the home care IT space, believe it or not. And again, part of my consulting company is also working with nonprofit boards, how to really get their leadership all aligned and moving lockstep. And so I was fortunate to work with the Oregon Center for Nursing and their board a few years back. So it really is a passion of mine. And when I retire in 2 years, I think I have my date as June of 2024. Because I think that is the driver and will be the glue for organizations to be successful and work.
I know just from my own experience and from other nurses that we speak to, that when you work in a team, that it functions well and that everyone is plugged in and engaged, and you just know you're in this flow of working, from the administrators and the managers down to the nurses at the bedside. It's an incredible feeling, and I hope all nurses get to experience that. But I think the more common experience is that you have a new manager every week, you have people that are put into leadership roles that have no formal training, and they micromanage the best that they can because they don't have the skills or the modeling or their mentorship to really break out of that pattern. So I think it's incredible that organizations that you work for can come in and help to try to turn those places around, because I think that definitely contributes to retention. Because sometimes you just get placed in these roles and you walk out on the floor expecting your day to go one way, and they're like, guess what? You're the unit manager for the day. So I think to have a more purposeful approach to it is so necessary for everyone down to the patient outcome level. Can you tell us a little bit to that end about how you've assisted organizations you mentioned in Oregon to create those high performing teams, the ones that just get it and work well together, from like the leadership role and how that works?
And I think, Brianna, it's so challenging. You really have to look at, not only what the vision of the organization is, but what the vision of your department is.
Yeah.
What do you want to achieve? And if you don't effectively communicate that to the group, you're never going to get alignment.
Yeah.
And you also have to look at what other departments do I work with on a regular basis, and are they aligned with what they do, with what we do? Everything from timing and scheduling and operations being rudimentary, right?
Sure.
To the vision and understanding of how the flow is going to be and what services we provide. So there's no unmet expectations or unspoken expectations. And I think a lot of times we just assume that this is going to work because this is how we operate. But when we move somebody to a different setting or work with a different department, we're not aligned.
Yeah.
And then that ultimately affects the execution. We can't seamlessly execute. We come up against barriers, unintended consequences. So really working with the teams is saying, okay, what is our vision? Am I, as a manager and a leader, am I communicating my vision? How do we align with other departments? And then how are we going to execute? And so I was also fortunate enough to work with one of our universities as they grew so fast. And many people took in roles because they had the ability to do so. But now that the organization's larger and they're hiring more people, what they realized is we had to unbundle some of the roles that are under our staff because it doesn't make sense for alignment. And why should 4 people touch the same thing?
Right.
So very interesting conversations that when you look at it from a common sense perspective, you're like, of course this makes a lot of sense. Brianna, actually unpeeling the onion, unraveling these bundles, having the incumbents who are in the job share what their fortes are, what they want to do, to say, Gabby does it better than Marcia, does it better than Brianna. So how do we align that work? Right. You don't necessarily always want to align the work with the people in the room. But if you push comes to shove and you don't have extra, FTEs or consultants or part-time folks to come in, sometimes you need to align that work with what that person's times and talents are.
Sure, right.
We were also fortunate as the Connecticut League for Nursing, as I mentioned, working closely with the workforce development boards, and we have for the past 15 years. One of our workforce development boards, called the Workplace, which covers our southern half of our state, had received $25 million over 10 years to work with residents within that geography who wanted to go into healthcare. And so the federal government said, well, we're going to pay for not only attracting those individuals to the workforce board, we're going to pay for their education. We're also going to help you build employer work groups. So when these individuals are done, the employers will hire them. Right. And so we actually used one of our DISC workplace tools to help assess an individual's interests based on their behavioral preferences. So we actually looked at those 10 jobs to say, gee, these 4 are front of the house, where you're going to touch somebody, patient care, you're going to be on a unit, won't have your own desk, right? These 3 jobs are middle of the house, like radiology and PT, where you're going to have your own space. People are going to come to you. You're going to go to them. And then you have the back of the house jobs, billing and coding, medical records, where you have your own desk. You're not seeing anybody, etc. And so after taking the assessment and looking at people's behavioral preferences, and I think we did this with over 3,400 people over 10 years, by discussing, we really found out the more they knew about the role and the more they knew about themselves and what their comfort is. Many people said, I want my own desk. I want to put my picture up. I don't want anybody to come and bother me. So, I want back of the house job. So it was funny the way people really shared and had a first time opportunity to reflect alignment. And I think that's so critical, just as you alluded to in your scenario as well.
Yeah, absolutely. That's interesting. We've touched on some of this, but I wanted to know, as your role in nursing education, if you had any messages for nurses. Right now, times are tough for nurses for a number of different reasons, but to help them going, to help them keep going, for the ones that are thinking about higher education, reasons to pursue their career. I mean, we talked a little bit about the bottlenecks and how much time it takes to develop those types of nurses for advanced practice. But what's your best message for them, for those that want to accelerate where they are in nursing?
I think it's critical, and I think the message is stay the course. Our nursing schools, we just did a survey, not only to find out what kind of vacancies we had for faculty,
Mm-hmm.
because we actually submitted a very, very large multi-million-dollar proposal to our Governor's Workforce Council, and that is actually moving through the legislature right now
Wow.
for hopefully funding for a big, big fund for nursing faculty simulation, as well as transition to practice programs. So
Mm-hmm.
hopefully we'll have some great news in the future on that. But I would say stay the course, because in addition to the survey, we asked related to what type of master's program capacity do you have to produce future clinical educators.
Right.
You don't have to have masters in nursing. It could be leadership or another discipline. And so what we found out was the enrollment in the master's programs is declining and more people are stopping out. So although you're crazy, overburdened, etc., please stay the course and continue moving forward with your master's. Even if you're only going to drop to one course a semester, talk with your academic advisors, talk with your programs at your schools, see if you can continue to move forward, because to stop out now, I know everybody's exhausted, is only just going to delay, if not mitigate you from pursuing to get that advanced degree,
Right.
which in most of our states, we have 23 or 24 states now with independent practice for the nurse practitioner
Right.
and
Right.
nurse. Wonderful opportunity to truly provide your expertise to our communities who need healthcare desperately.
Right.
So the flexibility that that degree awards you
Yes.
is invaluable and
Yeah.
hopefully could bring you life balance, where now as part of the churn, there's no life balance. There's mandatory overtime. There's moving you into different departments that, as we both talked about, may not be best aligned for you or may be a toxic environment. So
Right.
we really need to reframe, set our priorities, and look at where you are and what you want to achieve. There are
Yeah.
organizations like the Connecticut Center for Nursing Workforce, the Connecticut Nurses Association, your professional and trade associations that are there to support you, as well as national entities, tuition reimbursement. So please talk with someone. You are not alone. There's many, many resources for you, and we're here to support each and every one of you.
Yeah, well, that's wonderful. I think it's reassuring for nurses that are in that track right now to hear that, because I think one of the common misconceptions that we hear on message boards a lot are that the nurse practitioner world is oversaturated. And so that, while that may be true in one particular niche community, now, today, in 4 years or 2 years or 1 year, it may not be the case. So nurses, like you said, just keeping going, stay the course. And I love that you've given us a glimpse into the back door, or the back office of how all these things play out, and where the true bottlenecks lie, because I think it's hard for us to see that on our end. Lastly, I'd love to talk about community. We are huge about community at Nurse Tech. We try to bring as many people together in a common environment, so that we can all heal throughout this ongoing trauma that we're all experiencing, that the ones that are really in areas of surge. If you could speak a little bit about your experiences with community and with nurses specifically, and how you think they could benefit from our online community specifically.
And Brianna, I think even prior to the pandemic, our nurses were just tapped out.
Yeah.
I think the complexity of the patient in all settings, as everybody says, our skilled nursing facilities are the med surge of 5 and 6 years ago. I think that our organizations have not been proactive to address workforce culture as our colleagues in business have. I think our organizations do a great job in working with patients and families, but as in supporting the existing nurse in his or her, as well as social worker, this could go for all healthcare roles. There was a miss there. And so we saw a huge surge of experts and professionals around the globe come together from the pandemic. Organizations that I never knew existed that were unbelievable and phenomenal. The hard part is, just like Nurses in Connecticut, we're the best kept secret around. We host a student day. This is our 42nd year.
Wow.
We used to get 1,000 senior RN students in one room, about 50 to 60 employers, national keynote speakers sharing a day of transition, sharing that you're not alone, sharing that you have a community, not only of those who you start in your workforce with, but if you're a manager, et cetera, whether it be the hospital, you have a community. And I don't think our nurses, because at that time, they didn't really feel they needed a community. Right. So I think now more than ever, organizations like NurseDec providing a foundation and forum is critical. I think all of our, just ran into one of my board members, even though she worked for an organization, has her own company on stress and resilience. Phenomenal work. Some of our fellow board members who run organizations are hiring her. So I think we have so many resources. Nurses never feel that they need them. I think now is the time for us to actually showcase what's available, invite the nurse to participate, and engage them in how we individually and collectively can move them forward. Right. So thank you so much for the forum that you provide, not only on a local basis, but a national basis, to bring the voice of nursing to a greater audience.
Thank you. That was a beautiful answer. I'm not going to try to paraphrase. I think that was perfectly put. And thank you so much. I think we don't get to see the back end of, and I don't even want to say the back end, but the administrative roles of people that are working in healthcare that aren't necessarily nurses themselves, like yourself, but that are working on so many different levels to improve working conditions. I know that it's a huge topic in nursing right now. A lot of these conversations we're having here have to do with what nurses are experiencing on the front end, but to know that for nurses that want to do something about it, we have all this built up kind of kinetic energy that we just want to apply somewhere to help the problems that we're seeing, but I don't think know necessarily where to go. So I think we're going to link to the organizations that you work for and that you've mentioned, so that nurses that are interested in this and enacting change, they have people to network with and talk with and find a community with. So thank you so much for giving your time to us this morning. We always like to open the floor up if there's anything else you wanted to mention, or any lasting messages you want to leave with nurses watching and reading this right now.
And Brianna, just my last thought, because we work in our own areas, like the Hospital Association, when I used to work at the Hospital Association, it opened my eyes to what's available in acute care.
Yeah.
I also had done consulting for our home care association, our long-term care association, other associations in New England. And when we're really looking at what's currently happening, we are focusing mostly on the acute care environment and those employees. I think our long-term care and home care and community care are not higher up on the food chain. And their needs sometimes aren't expressed in such a critical way. Their reimbursement and their payer mixes for those entities predominantly are on federal pay. So when we look at supporting nursing, it's important that we invite our post-acute care partners to join us in that conversation. We've been fortunate to have direct stream of communications with our Governor's Workforce Council and our Office of Workforce Strategy. We had put in play that we are really looking for a paid chief nursing officer. So we ultimately were able to get that role in our governor's workforce strategic plan
Yeah, that's great.
2020. The role was just filled. It didn't turn out to be nursing only. It's healthcare in general, and it's a workforce director. But
Hmm.
again, I think what you to your point is, how do we communicate that it's important? I
Hmm.
think the paid role at that level is critical.
Yeah.
And then what that did was open the door to our organization being able to directly apply to the American Rescue Plan money that each state has. And so actually next week, we're putting forth two programs, and I'm chairing our post-acute care workforce on a statewide basis. One to tap into our nursing students at the
Hmm.
LPN, associate, and baccalaureate level to become certified nursing assistants to
Mm.
support our long-term care and also
Yeah.
home health aides. We're using the IntelliCare platform. And then we're also working on creating the first statewide virtual RN residency program
Wow.
for long-term care facilities.
That's great.
As they hire only a few, they can't afford a residency model. So
Right.
we're looking at doing a statewide model, helping those organizations build capacity, provide coaching and mentoring services. So hopefully the next generation of nurses who start in long-term care
Hmm.
will stay and become the future leaders and
Right.
provide that excellent quality care that every nursing home has
Yeah.
been putting forth, especially during the pandemic. So
Yeah.
we're honored to be involved in that process and hope that funding comes through. And I'll keep you up to date on
Yeah.
two submissions and then the big one. But lots of activity has happened. And I think
Yeah.
because you alluded to, organizations like ours are no longer just fanning the flames from the bottom, or fanning the coals, hoping that we get a big fire, but
Right.
really at the center of the conversation. So
Yes.
excited to continue with our work.
Yeah. Awesome. Well, thank you so much. We've loved hearing your perspective and giving us so much information and insight into the work that you do and the work that alongside other people that are doing right now. So.